Role of the promotion of functional independence. Again, when a patient or resident is admitted into a facility, the goal is to make sure that we help maintain their functional independence. We don't want the patient or the resident to decline in their functional state. So the disciplines of nursing, rehab, and restorative nursing bridge together a goal to help maintain that functional status, their functional independence. We want patients and residents to be as functional as possible, and that is the overall goal for their stay in our facilities. How long residents and patients stay in the facility depends on their care needs. Long-term care is generally needed for more than just a few days. Some are there for 30 days or 60 days. Again, it depends on their need for functional and for overall nursing care. But for most who are admitted into a long-term care facility, they are there indefinitely. Their needs are chronic, which means they might remain in place in a facility indefinitely until their death occurs. For short-term services, meaning those that are less than 90 days, those are patients who are admitted to the facility for rehabilitative purposes. If they've endured a stroke, if they've been in a serious car accident, and they need to regain their functional status where they could return home to regain their previous functional status, then that's the goal. And that usually happens, their stay is usually for 90 days or less. The use of current technology is very important in long-term care facilities today. There are useful applications. There is a lot of advancement in technology. Most facilities today are utilizing electronic charting, but not all. Not all companies are there yet, but they are certainly working on it. There are a lot of, again, different applications in most departments, but the goal is to help increase technology for each department so that department heads and department managers can help their employees reach their best functional state as employees as they provide care for residents. Use of evidence-based practices. This is very important as we prepare to deliver care to residents. We want to make sure that we're meeting all of their needs, physical, mental, social, and spiritual as well. So that's a holistic approach. And as we attempt to deliver care, we want to look at best practices per discipline. What protocol should be put in place to render nursing care, to render therapy or restorative nursing or social work practices? So we look at best practices and protocol that are set in place to help deliver care. And usually those best practices are evidence-based practices. Those are delivered through us through a lot of different educational approaches, and then we take that education and teach it to our employees so that our residents are receiving the best care possible.